All right. Well, we had over 140 folks signed up and registered. So I'm going to go ahead and get started with my intro for folks that are jumping on, because I know that you really want to get to the meat of what's in this legislation, how it impacts you and your families, and get your questions answered. So hello and welcome to our special Oregon Afscme Town Hall on the American Rescue Plan. Before we begin tonight, I want to thank you for joining us on this call. But most importantly, I want to thank you for everything you've done this past year and continue to do to provide the necessary and needed services to folks throughout our state. And all your efforts at all levels to push for policies that reflect our values. We have a very diverse union, but one thing I can always count on, that when there's a crisis, you're always there. You're always stepping up, stepping forward, helping out, and showing up. Even after a year, you are still continuing to do this. So I just want to thank you again for all you continue to do. And that is one reason I am so excited to have this discussion tonight, because this is the funding that we have needed at the state and local levels and the individual support that we knew we so desperately needed. And I am so grateful for all of your work to help get this legislation passed. And I am so very grateful for International President Lee Saunders and his dedication and his leadership in making sure that this package included that local and state support that we all needed. I'm not going to take up too much of your time because I know I just would rather go ahead and get started. So with that, I'm going to turn it over to President Lee Saunders. Lee?
Thank you, Stacy, and hello, Afscme family. It's great to be with you all this evening. I want to thank Stacy, first of all, for the work that she does every single day, not only on behalf of Oregon Council 75, but sitting on the International Executive Board and helping me guide this great union that we call Afscme, 1.4 million members strong. So let me cut right to the chase, because I know it's in the evening and a lot of folks have other things to do, but you're on this call because you want to hear about the success that we had in Washington and what it means for you in Oregon. So I want to cut right to the chase. The signing of the American Rescue Plan is an historic win for our union and for working families all across the country. Make no mistake about it. This new law invests $350 billion in aid to states and counties and cities and towns nationwide. State and local governments will now be able to close budget gaps caused by the pandemic, avoiding devastating cuts, devastating layoffs, and furloughs. This funding will keep public service workers on the job doing what we do best, keeping our communities safe, keeping our communities strong. There's a lot more in the bill to help working families and public services specifically. Behavioral health, for example, is a huge organizing priority for Council 75, with nearly 1,000 members added over the last few years. And behavioral health has become an even more pressing societal need during the pandemic. This new law responds to that demand by including $3 billion nationally to support behavioral health. Now, Dahlia Thornton, Afscme's Director of Research and Collective Bargaining, will talk in more detail about the new law in a few minutes. But I want to focus on the power we demonstrated in getting it passed, all of us collectively together. In March of 2020, Afscme launched a strategic advocacy campaign called Fund the Front Lines. It included television ads and social media blitzes. It included dozens of telephone press conferences so we could tell our stories, so you could tell your stories and talk about the sacrifice that you've made. Stacy joined us for one of those calls and talked to the media about the courage of Council 75 members doing everything possible to protect their communities, to protect their neighbors. One story in particular really moved me, and it still does. And I talked about him throughout the early days of the pandemic. An OHSU respiratory therapist named Casey Farr, who was thinking about updating his will because of the very real possibility he could contract COVID on the job, the lack of PPE, the lack of proper equipment. Now we're talking about a guy in his 30s who had a newborn baby at home, and he was worried about what would happen to his family if he didn't come home from work. The Fund the Frontlines campaign included a huge grassroots lobbying push as well, with Afscme members contacting Congress by phone or email more than, now get this, 150,000 times. And at the end of the day, they could not ignore our collective voice. It took many months, a lot of blood, sweat, and tears. And it also took bold political action on our part to win the 2020 election and change leadership in Washington. But we did it. You did it. Thanks to your tenacious activism, we have a sweeping new law that will allow us to save Afscme jobs, crush this pandemic, and vaccinate hundreds of millions of people. This is the union difference in action. I want to repeat this. This is the union difference in action. This is the progress we make when we come together with strength and solidarity. So I'm going to ask you to do this. Talk to your coworkers. Tell them about the union difference. If they aren't members, ask them to join. If they are members, encourage them to become activists in our great union. You know, when we join a union and we stick with our union, especially in moments of crisis, we accomplish great things. Thank you. Thank you for everything you've done over the last year. Thank you for what you will do in the coming years. Let's bring the same fight and the same unity to the challenges ahead. Thanks, everybody. Good luck. Godspeed.
Thank you, President Saunders, for that very stirring and inspiring remarks. We're also pleased to have Dahlia Thornton, from the Director of Collective Bargaining and Research from the International Union, with us to go over the details of this plan and dig a little deeper.
Great. Thank you, Vice President Chamberlain, and thank you, President Saunders. And of course, thank you to all the Council 75 members who fought tirelessly on the front lines of this pandemic and to get the American Rescue Plan over the finish line. So what does it all mean? Can I ask David to put the PowerPoint up, please, if you could? So I want to dig into the details a bit and just talk a little bit about what it all means. To begin, let's look at what it means for Oregon public service workers. The American Rescue Plan ensures that state and local governments have the money to pay for public services, full stop. That was what the intention was. This is what Congress was thinking about when they wrote this law. They recognize the critical work that you do every day. Like the rest of this country, Oregon needed help to get past the threats to our health, jobs, and financial security. Since the pandemic began, we have collectively lost more than 1.2 million government jobs, including almost 25,000 jobs in Oregon alone. The American Rescue Plan includes unrestricted aid to states and local government to help them get through the next few years. That aid is intended to help states and local governments cover the cost of COVID expenses and replace lost revenue. The state of Oregon is slated to receive more than $2.6 billion, and that's just the state. For comparison, in 2020, total revenues for the state of Oregon were $28.8 billion. So it's like the state just got a 9% lump sum bonus. Also, there's another $1.5 billion going to cities and counties like the city of Portland, which is going to get around $217 million. On top of the flexible state and local money, other Oregon employers will see substantial relief from the American Rescue Plan as well. Colleges and universities get direct aid for themselves and for students. So for example, OHSU gets an estimated $2.87 million. K-12 gets more than $1 billion total to help reopen schools safely for in-person instruction. On average, that ends up being about $1,800 per student. The law also includes targeted help for other public services in Oregon, such as $330 million to support public transit in the Portland metro area and $2.9 million for Oregon public libraries. We've been clear about this since the beginning, that if we don't control the health crisis, we can't control the economic crisis. And this law provides more money to support and enhance Oregon's efforts to protect your health and get the pandemic under control by opening more vaccination sites and expanding testing. Next slide, please. It's also important to think about what this means for Oregon families and workers. The families of 780,000 Oregon children will receive an extra child care tax credit of up to $1,600 in 2021, lifting 40,000 of those children out of poverty. This is huge. This is going to make huge differences for these children and their families. There's also help for childcare through changes to the dependent care tax credit and dependent care FSAs. As many of you already know, the American Rescue Plan offered stimulus checks of $1,400 per person, up to $80,000 if you're single, and $150,000 if you're married. And that's in addition to the $600 stimulus checks that folks got in January. To buy some time for the recovery to kick in, the American Rescue Plan also provided targeted relief for those that were hurting the most. Something that our union fought hard for to the bitter end was ensuring that if you lost your job, you weren't out of options for health care. For those workers, the law includes fully paid for COBRA insurance coverage. So this lets you keep the health benefits that you had at the job that you lost through September. Another key element of this law was ensuring that the unemployed not only had health care, but they also got a check to get them through the crisis. The American Rescue Plan offers unemployment benefits to people who don't regularly qualify, like gig workers and other self-employed people, for all workers receiving unemployment benefits through the beginning of September. And it also gives them $300 a week on top of their regular unemployment benefit. That's because your regular unemployment benefit otherwise would only cover up to about half of your lost wages, and that's capped in the state of Oregon at $673. There's also more money to make sure that kids and families have enough to eat through programs like Supplemental Nutrition Assistance Programs, also known as SNAP. Before I turn this back to Vice President Chamberlain for questions, I also wanted to share a tool that we created that'll help you to access the key highlights of the law. It'll also show you if your members of Congress voted to support the American Rescue Plan. That tool can be found at rescue.afscme.org. And we want to show you a quick clip of what that looks like. If you could please play the clip of that, David, that'd be great. Thank you. So you'll just enter some key information in there, and it will give you some count. You'll put some county information in, and you will figure out who voted with us and who didn't vote with us. And Joe will tell us more about what all of that means shortly. But I will turn this back to Stacy, and she will go through some questions, I believe.
Absolutely. Thank you so much, Dahlia. You know, the IU has done such an amazing job. To think that this was only signed into law less than a month ago, right? And I really appreciate, you know, President Saunders and Dahlia and the efforts getting this passed, and then not skipping a beat, making sure we have the information that you all need. And so we want to take some questions now from folks on this actual plan before we go over to Joe Basler to hear what the plan is to dig deep, both at the state legislature to make sure the money that Dahlia is talking about ends up invested in the places we want, and also that we're bargaining at our local tables in the best way to take advantage of these funds coming in. So before we go there and talk about our state plan, do folks have questions on the any of the information that Dahlia has gone over or the plan itself? Remember, if you haven't registered a question, you can go into the Q&A at the bottom of the screen, and we have staff monitoring that. And we're going to try to get to as many questions as we can. If they're a little too nuanced, some of the questions, we will do our best to answer those in a follow-up. So the first question we have is from Eric Feely from DEQ. While he understands the money cannot be used for retirement, can it be used for retirement incentives if we're negotiating those at the bargaining table?
That's a really good question. So the law very clearly laid out uses of the money and restricted things that you cannot use the money for. So there are two things that you cannot use the money for. One is that we can't use it for pensions, and the other is that you can't use it for tax cuts. So that is what I believe you're referring to, that you can't use it for retirement. But in terms of retirement incentives, that's a really good question. So I'm going to give you a probably non-satisfying answer because it's it depends. So it depends on the circumstance that we're in. The money can essentially be used to cover COVID expenses and to fill revenue holes. So if the jurisdiction that we're talking about has significant or sufficient revenue hole to be able to fill in this situation, then you can fill it with those funds, and then you can bargain for those funds to be used for incentives. So if there's a revenue hole that's there, you can fill it, and then we can bargain for that money to be used for incentives.
Fantastic, thank you. The next question comes from a childcare provider. I have to purchase my own health insurance. What steps do I need to take advantage of any of the benefits underneath this act? And are there any deadlines I need to be aware of?
Also a really good question. So the law provides for enhanced subsidies under the, there's subsidies if you're purchasing on the open market. And so you can get those extra subsidies. The state of Oregon actually extended the deadline for you to be able to purchase those subsidies. So your deadline in Oregon is May 15th. So that is your deadline. So you need to go do that as soon as possible. It is May 15th. It is at OregonHealthcare.gov. So that is your first step, is to go to OregonHealthcare.gov. And you would put in your age and your income level so that you can see what you're qualified for, what subsidies you actually are qualified for. And there are enhanced subsidies. So definitely go there very quickly.
I'm glad that we had that question. We'll make sure to get the information out to everybody in the follow-up as well. So this comes from a member who has crushing student debt. Is there any relief for us in this package?
Well, unfortunately, not really. So there was a lot of hope for some student debt relief in this package, but there was not much. So at the last minute, so I want to be clear, unfortunately, the law does not cancel any debt. There is no cancellation of debt in this law, but it does anticipate that there is a possibility that debt cancellation could happen at some point. And so again, an unsatisfying answer. But if it does, if and when it does happen, it wouldn't be counted as income. And so if debt was canceled and the law didn't cover this, it would be counted as income. So it does look at that if it does actually happen at some point, and that might be something that the Biden administration has been talking about doing, and that is something that would be possible under the Biden administration or a separate legislation, that it would not count against your income. So that is what the law provides, is that it wouldn't count against your income, but unfortunately it did not do much.
And then Dahlia, we have two more questions, and it really just tees us up right into Joe Basler. So the first question is, can we use this money for COVID pay for workers that did not get the option of teleworking? And if so, are there any limits?
So if I understand the question about COVID pay, I think it's about essential workers. So this is about essential workers. So essential workers, the law was pretty clear about essential workers. That is definitely a category under state and local. that is a permissible use of funds. So that was absolutely a permissible use of funds for state and local money. And so if you have state and local workers that you have deemed as essential workers, you can absolutely use that money. That is a permissible use of funds. There are limits there. The limit is up to $13 per hour and up to $25,000. So those are the limits that are in place. But there are some caveats here. One, and the big caveat here is that we've got to bargain for it, right? So we've got to make ourselves a priority. If I had to guess, I don't think any employer is going to say, sure, give us that $13. They're probably going to want to use that money in other ways. And so I would guess that we're probably going to have to fight pretty hard to make ourselves a priority for that. So certainly that possibility is there. And then also, not everyone is going to qualify as an essential worker. You would have to be deemed an essential worker. There are certainly some definitions of essential worker. And so that is something to also keep in mind.
Thank you, Dahlia. We actually have one more question come in that I think is really one that I know that I've heard a lot that I'll take, and then I'll turn it over to Joe. The credits that are available for state and local governments to recoup the cost of sick and family leave, do these cover 100% of the costs for state and local governments for this leave, or is there some other percentage?
So there's that's a good question. So there's an incentive here for finally for public sector. The other leave that we had previously, so in 2020, this was not extended to public sector. It is not 100%, but it is now incentivized. So it is certainly better. We'll still have to negotiate it, but it is certainly better than what we had before because it is now extended to public sector. So we're in a much better position, and it is certainly incentivized where it was not before for public sector. So much better, but not at the same, not at 100%.
So the next question I am just going to tee up for Joe Basler. We have our Associate Director, Joe Basler, here, and he's going to talk to us about how we're going to take all this amazing stuff, because Steve Sander wants to know what's the best way to push how the state money should be spent in light of our current negotiations. And Joe's going to talk about what we're doing at the legislature to try to push for this funds. And then we're also pushing some model language that we're pulling together for the local tables. But I will turn it over to Joe and let him tee that up.
Hey, thanks, Stacey. And David, I have two quick slides. Probably better to look at them than look at me. So I just want to go through. So the federal money, Dahlia talked about it, but I can't overemphasize enough how important it was to us in Oregon. We were looking at a $1.5 billion budget hole to get to current service level, which state agencies were looking at a 10% reduction based on that, maybe like an 8% reduction, but that's still significant job loss, significant layoffs. And this money has come in and really saved us. I mean, they're still talking about cuts, and I'm going to explain that in a second. But without this, we would have been in a lot of trouble. And because we also know that it's not just that there was an economic downturn, we also know that there were industries like childcare, but also our local governments and behavioral health that took significant hits and also significant increase in demand at the same time. It's that sort of perfect storm in Oregon where, since we're income tax based revenue system, like as jobs start, people losing jobs, demand for services start going up. We have less money for services, and the hydraulics of the Oregon tax system is, to be blunt, stupid. And so this federal money is saving us in a lot of ways, more so than I think probably some other states. So as Dahlia mentioned, there's several pots of money. The state like I said, she said, is getting $2.6 billion of state aid. The legislature has a plan for about 50% of it, and which is, I will spell out in a second. The governor also put forward a plan, about a 10-point plan on how to spend the money, but it's very priorities driven. It's not very specific about what actual programs will get X amount of money. It's mostly like, we want to support those who are most impacted by the pandemic. We also want to get the economy back rolling and protect vital services. I mean, all good stuff, but not like $100 million for X, $200 million for X. It was very aspirational. But the state has so far put forward pretty clearly, the legislature pretty clearly how they want to spend the money. They want to spend about 50% of it to fill the current budget hole. So about 1.3 billion to fill the current budget hole. They in the 2021-23 budget. There is a lot of concern that there is in the next budget cycle, the 23-25 budget cycle. Sorry, that's just how biennium is how they call it. That we're looking at another major hit, but with no federal money coming. So the legislature is very nervous about how to spend this money. We are pushing on them because we think their dire estimation of how the economy is going to go is overstated. And if we can invest this money appropriately and properly, it'll actually be a huge boom to our economy and sort of offset any of those future losses. So like I said, they're going to spend half of it on the current budget hole, but they still want to do some cuts to current service level, which we disagree with. And we're going to talk about that in a second. They want to spend $30 million, 30%, $780 million on this biennium on new programs and on one-time spending. The reason why they're so fixated on one-time spending is they're worried that they won't have as much revenue in the next couple of years. So, for instance, asking for a 5% COLA is not going to fly to use this federal money because the legislature is too afraid they won't be able to have the money to cover that cost in 2 or 4 years, which is why one of the reasons why we're going to talk about essential worker pay is a one-time payment. There are other programs we are pushing them hard on that do have some future costs, or what they call roll-up costs, reoccurring costs or roll-up costs. They're also going to spend, this is the part that's the most frustrating with the legislative plan, is they want to take 20% of it and set it aside. I call hoard it for future expenses. For that 700, and I'll get into how that's, I'll get into why we think that's stupid in a second. For the 780 million they are willing to spend, they're trying, like I said, they're trying to focus on one-time items with no recurring costs. The legislature has solicited ideas from other legislators on how to spend that money. Last week on Friday, they asked all legislators to submit ideas. We actually put in quite a few ideas to legislators that are on the list. And now they're going to wait a couple of weeks and sort of juggle those priorities and decide. We don't know when exactly it's going to be, but we're hoping in about 2 weeks we'll have a list of what their ideas are. Some of the ideas we put forward are payments for essential workers, also money to improve our behavioral health system, and also decrease workloads for human services, and also start decreasing the overtime that has just ballooned within the Department of Corrections due to COVID, and being trapped in facilities where COVID was raging through most of the last year. So hopefully, like I said, we'll know in a week or two how they plan to spend that 780 billion. In addition, like I said, we are very concerned the state plans to save over $500 million. We think this is a mistake. Like, the money is needed now and should be used now. As I mentioned, the legislature is concerned about the next budget cycle, which is, the forecast says, will have a significant budget hole. However, we think that that we have a record amount of reserves right now. So we have over $1 billion in reserves and no plan to spend that right now. If we save this money, we're going to have close to $2 billion in reserves sitting in different bank accounts and rainy day funds within the state of Oregon. So there's no reason to save this $500 million right now. We need to get that money out there working and supporting workers. So we mentioned this during our lobby day we had. Was that last week or the week before? My time frame is gone nutty. It was one of our major talking points. We're working with other unions right now, UFCW, SEIU, and PACUN, the Farm Workers Union, to really focus in on taking that 500 million. You can flip to the next slide, David. That 500 million and spend it on essential worker pay. We don't have all the details. My guess is right now we're looking at tiering the pay for more money for folks who make under $50,000, slightly less for folks who make under 100,000. Folks who make over 100,000, base pay. We're probably not going to get excluded. But we're still working out the details on it. We'll know more. I mean, the first step is convincing legislators they have to do this. I think Dahlia said it right. If we're not fighting for this, it ain't gonna happen. So we need to fight hard for it. We've been meeting with legislators for the last couple of weeks talking about it. We talked about it during our lobby day. And I think the next step in our process, there's two next steps in our process. Next, when we send a follow-up email to this Zoom, we're gonna have a email that you can patch through to you, so you can click to email through to your legislator to talk about your story and why it's so important, that essential worker pay is so important. And sort of we'll give you a set of talking points. That's going to be very helpful. Legislators need to hear from their constituents that this is a big deal. And if they don't, they won't do anything. The other thing to talk about, and I would love for, we'll also put it in a follow-up email. There is going to be what's called the Budget Roadshow. So the legislators are doing a series. It used to be a roadshow. They actually used to get on the road before the pandemic. Now they're doing a series of Zooms focused in on different districts around the state to talk about budget priorities. We really need to organize the crap out of those and have a lot of folks showing up and testifying about why essential worker pay is so important, because it is. One, we know that money is going to get turned right around and spent on this and help booster this economy get back on its feet. We also know that the reason why Oregon had such a low COVID rates compared to other states around us was because of the essential workers. Like, essential workers are the reason we were able to stay safe. And so we need to show respect for those folks. So there's the dates up there. Like I said, we'll send it out in the email so you don't feel like feverishly have to write it down. But they're coming in they're coming next week and for the next 2 weeks, when we really need bodies to show up and say, hey, this is important, this is a priority. And if we can keep beating the heads of legislators hearing that, then I think we'll be able to get it. We probably still won't know for about another month, but that's the best we can do. Stacy, that's all I got.
All right. Well, thank you, Joe. Obviously, we had to have a game plan for the state. We will be putting together a toolkit for locals to bargain, some model language at your local levels to address essential pay, because we're going to try our best to negotiate or to pass the law on essential pay that touches all of the essential workers, but we know that we might not be able to get it passed. So we want to make sure that we're able to negotiate that as well with some of these local dollars. To Joe's point, I just want to reiterate before we close tonight, we didn't get really any other questions that we're probably able to answer tonight. There's a couple others that are a little more detailed that we can answer in the follow-up. But I wanted to hit on something that President Saunders mentioned. Your stories matter so very much. I honestly think that we have one of the best political teams in Salem lobbying on your behalf. But the fact is that when you show up at lobby days and you share your stories at this budget roadshow, and you share these stories with this link that we're going to provide, that's what makes the difference. Your stories haunt people. President Saunders, that story happened a year ago, and he remembered Casey, right? Because that was one of the stories that haunted me. I have stories from members across the state in various positions that haunt me, right? That I think about when I'm talking to electeds, that get me choked up, that bring tears to my eyes because of the stress and the struggle that you all endured this year while putting everybody else first, right? And they need to hear that from you, because I can't convey it the same way. And we need them to think about you and picture you when they're voting on essential pay, not just calling you a hero, but actually voting in favor of providing the funding that you so desperately deserve. So please help us help you. We will be sending out a follow-up email with all of this information and links for you to take this action to help us get this passed. So thank you again, President Saunders, Dahlia, and Joe, and all of you for coming out tonight. Have a great evening, and thank you for everything you continue to do to make us a strong union and our state strong. Have a good night.